I think we're making very good progress. We're going to go when we have the votes. We think it's a really good step in the right direction. We're having very productive conversations with our members. I would argue that this is a bill that a moderate would more likely want to support.
Too many Americans are going to be without coverage, and the underlying amendment does not deal with that. In fact, I would argue that the underlying amendment, the amendment that's being proposed, actually takes us in the wrong direction and further weakens protections for people with pre-existing conditions.
This bill doesn't fully repeal Obamacare, and that's a problem. But it at least gives the states the option who get that waiver to get rid of those regulations. We think this is the best bill that can get out of the House of Representatives, or we wouldn't be supporting it.
Last there, Jim Jordan from the Freedom Caucus, as they are coming on board with this health care bill. As we have some new Fox News polls, President Trump's handling of health care, all people approve 35%, disapprove 56%, and you can see how it changes with Republican voters, conservative voters there. And then which is a higher priority? Fixing the health care system or reforming the tax system? It's an interesting result, 71% to 26% about health care. Let's bring in our panel. Steve Hayes, senior writer for the Weekly Standard, A.B. Stoddard, associate editor at Real Clear Politics, and Mercedes Schlapp, columnist for the Washington Times. A.B., where are we at this hour? Because it seems to change by the minute on health care.
Right. I mean, look, let's give the administration and the Republican leadership credit for really trying hard and not walking away from the table as the president first threatened to. I think it's incredible that they brought around a bunch of Freedom Caucus members, because this is Obamacare light, and it is not a repeal. It provides flexibility to the states, but...
And just explain that, a waiver so the states can opt out.
The states would have to come back and say, we think that if we don't require our packages to cover maternity and all these services, essential benefits is the language everyone keeps hearing, that our customers will get a better bill and it'll be better for our constituents and it'll lower their premiums. And they have to make that case on an individual basis. What the moderates who are balking at this are worried about is that in the end, people who are sick or have pre-existing conditions will end up paying a lot more, and they will pay for that politically, and they will own it finally. The whole fear of Republicans owning Obamacare. So at this hour, they don't have the votes. They could. They would need to sway. Interestingly, this time, with the conservatives on board, they need to sway more moderate voters. But again, the moderates aren't ready, just like on March 24th, to take a vote in the House, to see it fail in the Senate.
Because we've seen that before. There was a BTU vote that Vice President Gore was pushing back in the Clinton administration. Democrats voted for it, and then the Senate never took it up, and then they lost their seats because of that vote.
Well, I have to tell you, I think just speaking to a number of Republicans in the House, they're incredibly nervous with this bill. I mean, it makes no one happy. It is the health care reform bill that makes no one happy. And the centrists are concerned, the centrist Republicans are concerned that the bill is going far to the right, despite the fact that you have a centrist Congressman MacArthur and Meadows, the conservative, who have been working on this amendment. And I just don't see it. At this point, we have 21 Republicans that are basically a no. You know that if you have 22, you can't afford to lose 22 Republicans. And then you have about 50-something Republicans who are basically they're unsure whether they're going to move forward on this bill. I think it's still in trouble. And then let's even see if we can get it through the House. When you get through the Senate, there's going to be a lot more obstacles there in terms of conservatives even supporting something like that.
But staying in the House, I mean, they haven't gone to the Rules Committee yet, but if they do, they could conceivably do a vote on Saturday.
They could, and you keep hearing that there are people in the White House, Reince Priebus among them, who are pushing to push this up as quickly as they can.
The 100th day, by the way. 100th
day. They want an additional accomplishment in the first 100 days. This would certainly be it if they could get this through the House. I mean, the question, I think, is will the moderates ultimately come around? I don't think, I mean, they're complaining that the bill's gone too far to the right. I mean, many of the moderates were making that complaint with the original version of this. And I don't think the tweak has been that significant, as Jim Jordan suggested, but it's been enough to get some House Freedom Caucus members on board. The other question is, will you see the media covering these moderates as obstinate and intransigent and angry the way that they always do the Freedom Caucus?
Meanwhile, Democrats are just sitting back, as the other backdrop is the funding of the government, and they're working on what, a short-term punt for another week or two?
Yeah, I think it's the writing's on the wall. They're going to have a clean bill, and they're going to buy themselves another week. They got to make sure that next week they have a clean bill and they buy themselves until September 30th. Basically, the White House is against a shutdown. The Republican leadership can't afford a shutdown, and no matter what Democrats do, they need to just get something out the door.
And when we say clean bill, we mean it's not changing the current funding of the government, so the actual budget changes that the Trump administration wants wouldn't be factored in.
Right, which what you're also saying is that President Trump is, for example, allowing for these Obamacare subsidies, not being overly critical about that. And so you're seeing they don't want these riders in there. But I think when you're going back to health care with the Democrats, they're basically saying, look, we will oppose the short-term funding if you all move on Obamacare. And that's why you saw Speaker Ryan being very careful today in not saying we're moving forward on a vote. I don't think a vote's going to happen on health care on Saturday. I think they've got to get through the spending bill fight first, and then maybe possibly see if they could collect the votes or with the votes on the health care bill.
Quickly.
Yeah, and there's also tax reform. I mean, this is also tax reform rolling out this week. When you have these series of fights, I think the Trump administration really wants to have additional things to point to for the future, to be able to say, we've done this legislatively, we're making progress on our legislative priorities, not just that President Trump has done the things that you can do as president. They want to show some progress, and I think they're eager to do that.
Panel, thank you.